Good morning. All praise this morning. How y'all feeling? Uh, Today we're going to read an article from the New York Times that was written by Stephen Nolan, and the title is called Trying to Solve a COVID Mystery, Africa's Low Death Rates. So, um, just in a few minutes, we're going to read a couple paragraphs from this article. And I think this is important for us to talk about this morning because, we do know that COVID-19 is still out there. A lot of places they're dropping the mask mandates and just letting this um this this pandemic become a part of life, a part of everyday life normalcy. So it's important that we still be smart and use precaution and to keep ourselves as safe as possible. So I'm gonna read this article, and it's by Stephen Nolan from the New York Times. It was written March 23rd, 2022, and so let's start right here. It's this is Kamakwi, Sierra Leone. There are no COVID fears here. The district COVID-19 response center has registered just 11 cases since the start of the pandemic and no deaths. At the regional hospital, the wards are packed with malaria patients. The door to the COVID isolation ward is bolted shut and overgrown with weeds. People crammed together for weddings, soccer matches, concerts with no mass in sight. Sierra Leone, a nation of 8 million on the coast of West Africa, feels like the land inexplicably spared as a plague passed overhead. What has happened or hasn't happened? Hard and in much of sub-Saharan, let me get back to my topic article. What happened, or what has happened, or hasn't happened? Here in the much of the sub-Saharan Africa is a great mystery of the pandemic. The low rate of coronavirus infection, hospitalizations, and deaths in West and Central Africa is focus of a debate that has divided scientists in the continent beyond and beyond. Have the sick or dead simply not been counted? If COVID has in fact done less damage here, why is that? If it has been just as vicious, how have we missed it? The answers are relevant not just to us, but have implications for the greater public good, said Austin Demby, Sierra Leone's health minister, is an interview in Freetown, the capital. The assertion that COVID isn't as big threat in Africa has sparked debate about whether the African Union push to vaccinate 70% of Africans against the virus this year is the best use of health care resources, given that the devastation from the other pathogens such as malaria appears to be much more higher. In the first months of the pandemic, there were fears that COVID might evacuate Africa, tearing through countries with health systems weak as Sierra Leone's, where there are just 3 doctors for every 100,000 people, according to the World Health Organization. The high prevalence of malaria, HIV, tuberculosis, and malnutrition was seen as killing for a disaster. That has not happened. The first iteration of the virus that raced around the world has comparatively minimum impact here. The Beta variant ravaged South Africa and did Delta and Omicron. Yet much of the rest of the continent did not record similar death tolls. In the year 3 of the pandemic, new research shows there is no longer any questions of whether COVID has spread widely in Africa. It has studies that tested blood samples for antibodies and SARS CoV-2, the official name for the virus that caused COVID, so that about 2/3 of the population, that's most in sub-Saharan countries, do indeed have those antibiotics. Since only 14% of the population any kind has received any kind of COVID vaccination, the antibodies are overwhelmingly from infections. A new WHO-led analyst, not yet peer-reviewed, synthesized surveys from across the continent and found that 65% of Africans have been infected by the third quarter of 2021, higher than the rate in many parts of the world. Just 4% of Africans have been vaccinated when these data were gathered. So the virus in Africa, it is killing fewer people. Wow. So that's pretty good, man. And yeah, that's really good, man. Because like myself, for me, I thought like when the pandemic got there, especially in like the smaller villages in Africa, I thought it was gonna really affect people, but through the Most High, He spared the people in Africa from this pandemic, man. That's just a blessing, to say that um, so many people have lost loved ones, lost their lives, and you know, some people still fighting with this thing. But I wanted to share that with y'all this morning because I thought that was important, because I think it's the melanin that's in our skin that's kind of like keeping us from, getting sick with this, and the Most High's protection. So thank y'all for listening. I'll be back with the next one. That was a news clip this morning. Shalom. Peace.